I would enter my patient's room. I would introduce myself. I'll say, hi, my name is Mira. I'm going to be your nurse today. I would check for 2 patient identifiers, their name and date of birth, and I would check their wrist as well. I would make sure that after that, I would explain that I'm going to do the central line change. And then, yeah, I would put on proper PPE. I'd put PPE on my patient, which would be a mask and proper like etiquette or gloves, and then put a mask on myself. And then I would get my supplies, which I have right there, and I would wash my hands and begin the procedure. I'd wash my hands, put on the gloves. And this is just the clean portion of my procedure. I would open up my sterile field and get out my drapes. I would put out one of my drapes, glossy side down, by the corners, and then I'd do my second drape. And this would go over my patient right here. Now I am gonna put this on top, disregard this piece. I would probably use sterile gloves at this part, but I'm gonna use my regular ones right now. Everything is set up, and now I'm going to begin cleaning out the dressing, or the central line. I would begin by opening this up, my alcohol prep pad, and I'm going to clean around it to get it all moistened up, and then I would begin to unstick it, and I'd go from underneath, and I would unclip. I would rip from out to, and I would remove it. Now that that is done, I would discard my gloves, trash, and I'm going to begin proper hand hygiene and begin my sterile procedure. I'm going to take out my sterile gloves. This should not be here, disregard. I'm going to open up my gloves.
Is this the dopamine? Yeah. Okay, and then doing
now that I'm thinking about it, maybe the drape should be put out after, which probably was right.
They did 22, but
I apologize, Professor Chris. Oh my goodness. Can't even do that. So, throw away. And I wouldn't pull it out like that either. I'm just nervous. Okay. Now I'm going to take everything in here and dump it out. Because the box is. And then pop everything in the. Okay. Now I'm going to open this up. Should I actually open them? And I'm going to clean this portion.
I'm going to mix it that the clamp is closed.
And just get any dry blood
Over here,
underneath.
with the beautiful hexamine.
And I would not be touching the patient because I'm not going to break sterile field. And then I'm going to use this. I would pop it, pop, and I'm going to clean. I'm going to scrub for about 30 seconds to a minute. Clean, clean, clean. And I'm going to go all the way around, underneath, around, and down. Done with that. And then I would put my super prep. And I would clean this as well.
okay, so obviously the insert is 10 mils per hour.
After that, I would put on my antimicrobial circle, and then if I had it, per hospital policy, and then I would also put on my little like secure clamp thing that I have there as well to keep that in place. And once those both are on, I would not pull that either. Oh my goodness. I would then begin to open this up and attach it. I would put this on like this. And now I am breaking sterile field, but it is going to be clean now. And I'm going to bear with me. To do that.
Make sure you save the thing.
Yeah. And I'm going to push it down, and then I'm going to put oh my goodness. And I would initial, date, and time it, just so that I know what happened, and then I would chart that away and begin my next part of the video.
Go.
I am now going to be doing the changing of the cap. I'm currently clean. I'm going to gather all my supplies into my sterile field. And now I'm going to take off my clean gloves, perform hand hygiene, and put on sterile gloves. Now that I am sterile, I'm going to begin by grabbing the gauze. On. Grabbing my cleaner thingy. Clean. Now that it is clean, I'm going to grab another gauze and take this cap off. Now that it is off, I'm going to take this and I'm going to first prime it with my fluid. And now that it is primed so there's no air in there, I'm going to attach my syringe. I'm going to pull back for blood, and I got blood returned, and I'm going to push through. And now I'm going to get another one.
And when I was like licensure and certifications, I asked,
and flush it.
I'm so sorry, I had a question that came up.
Ooh.
Orientation period, and like, yes, there will be.
Girly Pop, what you doing?
Okay. Like, so
I want to flush it one more time.
I don't know. It was strange.
To turn it, take it off. I'm going to take off my gauze, and I'm going to clamp it again. And I would chart what happened.